So, doctor, tell us a little about yourself and the type of dentistry that you perform.
Well, I'm a general dentist, usually an adult dentist, but I began doing tongue ties about 4 or 5 years ago when I moved from Boston to Florida.
Okay.
And I got a laser and started learning all the things that you can do with lasers. And one of the amazing things you can do with lasers is releasing tongue ties. So that's how I ended up specializing in tongue ties. But I still do general dentistry too.
And that's amazing. A clip of you talking about your passion and performing a procedure called a frenectomy to remove a tongue tie. Let's watch.
Here at the office, I do all aspects of general dentistry, but my passion is using a sloped laser to release tongue and upper lip ties. Tethered oral tissues can cause all sorts of problems, especially for newborns. A tongue-tied infant often has difficulty swallowing, can't latch for breastfeeding, and suffers from reflux and gas. Breastfeeding a tongue-tied baby can be painful for the mother, too. If not corrected, the child can later have problems with speech, sleep apnea, and continued reflux. Adults often tell me that after releasing their tongue tie, they stop snoring, sleep better, stand straighter, have fewer headaches, and, of course, speak more clearly. I'm also passionate about research looking into the relationship between tongue ties and SIDS.
And it's such a simple procedure that is life-changing, Dr. Haller. And how do you begin to explain to a parent what a tongue tie is? Because many, as we were discussing off camera, don't even know.
That is very true. We all have webbing in between our fingers, and there's a little web underneath the tongue. If you look at this picture of the tongue, this is what people usually think of as the tongue.
Right.
But that's the top of the tongue. I would like to show you the other picture, which is of the bottom of the tongue.
Okay.
You see, when you lift up the tongue, there's that little piece of tissue under there. And in this case, it's creating a kind of a heart-shaped dip in the center of the tongue.
Yes.
Because it's too tight. Now, we all have that little piece of tissue there. It's called a frenum, or if you're from other parts of the world, frenulum.
Okay.
But this one in particular is too tight. It's creating a dimple in the tongue, and it's keeping the child from being able to lift its tongue up to the roof of its mouth and being able to nurse properly.
And when you have this, it also affects your upper lip? This is true?
It can. It's a midline issue.
Okay.
And so you can also have up under the lip another tie, which in some people you might know it can keep the front teeth from going together and create a little space there.
Yes, my 6-year-old actually has that.
Yes, but it's not only that. It can keep your upper lip from being able to flange outward to be able to get a seal around the breast when you're trying to nurse as a baby. And instead your lip will curl in, and the baby is then biting rather than sucking, and the baby will actually get little blisters on his lips because he's trying to nurse, but his upper lip is too tight.
And then it causes obviously a lot of pain for the
mom and not very much success for the baby.
Wow. Okay, we have some pictures of babies with a tongue tie. So, doctor, if you can please explain what we're looking at here.
That's a lovely tongue tie. You see, this is very thin, and they can be anywhere along a continuum of thick, thin, fat, short, long. This one, if you aren't trained to know what to look for, could look fairly innocuous.
Right.
But in fact, it is very tough tissue in there, and it goes deeper, further back than you think. You just see that little thin part in the front that's attached, but it goes way much deeper under the tongue, and it's keeping that child from being able to get the tongue up to the roof of its mouth.
Now, are there severities in terms of being tongue-tied where, as you mentioned, they could be big, they can be small, they can be thin, they can be a little fatter, so does that affect?
It makes a difference, yes. The diagnosis of tongue tie is both appearance and symptoms. It's in fact more symptoms than appearance. The symptoms are, for instance, a baby not being able to latch effectively. It can be milk dribble out the side because the baby's not getting a good seal. A baby getting a lot of gas because the baby's swallowing extra air. It can be lots of reflux because the baby's choking on getting too much food in its lungs or in its throat.
We actually have a photo of some babies who have an upper lip tie, so this probably better explains what you're discussing, right? Correct?
Yeah, so the upper lip, in fact, look at the picture in the very center. You see there's like a little bubble on the baby's lip?
Yeah.
That's a blister.
Oh my gosh.
From nursing with your lip curled
and not
under.
being able, right.
And you see how tight that is? You should, a baby without a tie, you should be able to pull that lip right up over the nose.
Okay.
And then also if you look at that center one, you see the tongue is coming up, but it's still held down at the base.
Right.
And so those tongue ties can be very difficult to diagnose just by looking at them.
Right.
Some of them are way back deep at the base of the tongue, and unless you know what symptoms to look for, you might say, oh, well, looks okay to me.
So in that case, what symptoms are you looking at?
I'm looking at inability to latch. I'm looking at mouth breathing. No baby should breathe through its mouth. These babies often hate lying on their backs because they can't keep their tongue out of their airway. These are some symptoms that are typically listed. Difficulty lifting the tongue. Sometimes just the front of the tongue will lift up. The trouble sticking out of the tongue is a symptom that's frequently listed, but some babies with tongue ties literally have a tongue thrust because the only direction they can move their tongue in is forward. But what you really need for nursing is up against the roof of the mouth, not just forward. Wow. And so once we release that tight frenum, the baby might take a while to learn that thrusting isn't what we want the tongue to do. We want it to go up. But they're very clever. They learn.
Now, let's take a look at some facts about tongue and lip ties, and let's go over these, starting with, it can occur more in boys than in girls.
It's a funny thing. It has a hereditary component.
Okay.
And I'd say 3 out of 5 babies will be boys. And
wow.
It's not that girls don't get them, but it's usually more boys than girls.
And tongue and lip, they occur together.
They can.
But you can get them separately.
Exactly.
As well. Okay.
They both happen on the midline. My experience has been if you have a significant upper lip tie, you're going to have a tongue tie. But you can't have a tongue tie without an upper lip tie.
Okay. And now, many adults, this is interesting because usually if you catch it a little earlier in childhood, but many adults have tongue ties.
Well, yes, we went through an era in the 50s when one formula was developed and women started going back to work. And so babies got bottle fed instead of breastfed. And you can bite on a bottle and get a lot of nutrition that way. And so there's a whole generation of us now who grew up with tongue ties and don't know it.
Right.
Because you compensate, you learn how to cope with what you have, and you think that's normal.
So you see maybe an adult with a lisp, that
or
could be
head and neck pain, TMJ pain, constant headaches, sleep apnea,
all
lots
tied
of
to
things.
tongue.
All tied to. The fact is, this thing that looks so little and insignificant is connected to the hyoid bone and a lot of different things down here that pull your head forward and cause all of this neck and shoulder pain. So people will come to me and say, I've been to the acupuncturist, the chiropractor, and they make me feel better, but it won't stay.
Right.
And so once you release those cords, it helps a lot.
I can't stop thinking about Dr. Haller, how you got into doing the tongue ties to begin with as a dentist. So can you tell me what got you motivated to do this?
Well, when my husband and I moved to Florida, and I had a little break in between when I left Boston, I had to get a Florida dental license. So I had a while there where I wasn't able to be a dentist. So I decided, what do you do when you can't work? You go to school.
Right.
So I went back to school and started learning about lasers, and have since become board certified in laser dentistry. And one of the things that you can do with the laser is release these tongue ties. And when you start doing this, and you take a mom who brings in this baby, and the mom is beside herself and is sure it's her fault and is really miserable, and you take the baby back, in 10 minutes you fix it, you bring the baby back to her, she breastfeeds the baby, it doesn't hurt, and she feels like $1,000,000, and she thinks I'm God, which is amazing. It's something that you like to do.
It's life-changing. Add to that?
Well, it's really true. I see in 2 broad categories of infants. I either see what I call the fussy babies or the sleepy babies. So the fussy babies are the ones that are full of gas and they're hungry and they're just crying all the time.
Right.
And then the sleepy babies are the ones that aren't consuming enough calories to even cry.
Right. They
And
don't have
so
the energy.
They don't have the energy. And so for both cases, helping them be able to eat, to feed, is key for helping them get better. So you release the frenectomy, or you do the frenectomy, you release the frenum, and the crying, fussy babies all of a sudden are getting enough to eat, and they're not having so much gas and so much reflux. The sleepy babies are getting enough to eat, and they're not sleeping so much. So it's one of those things where they're not getting enough calories.
Definitely can be like